Okay, LaserQuit therapy for addiction and alcohol. How does it work?
So we release endorphins in your brain, similar to the ones that you release when you do a drug or alcohol. And by releasing those endorphins, we are able to remove your craving and oftentimes the desire and the thought about it as well.
How do you release the endorphins?
So we're based on acupuncture points, but we use a cold laser, which is LED light and low-level radiation.
So what does the procedure look like?
We have trademark secrets, so we can't tell you exactly what that looks like. But a typical treatment would be about 30 minutes. You spent about 10 talking to us, having a conversation so that we can make you understand your addiction. And then we give you a 20-minute, depending, 20-plus minute treatment to get the outcome that we want, to relax you and remove that craving.
So it's as simple as relaxing and removing the craving?
It's using your body's energies to create the outcome we want, and all you need to do is relax and let us do our treatment. And when you leave, you typically will have zero craving, zero thought. 85% of our clients have zero desire after the first treatment.
And then how many follow-up treatments are included?
So there's 4 treatments included, but you don't necessarily need to use them all. We do recommend that you use them all, but often after the first treatment, most people are quit and have zero desire. We recommend you come back every 8 weeks for all 4 treatments in order to make it so that your outcome is the best.
And how is the long-term success rate?
Still 95% up to 1 year. We stopped following up after about a year because by about 6 months, it's your choice whether you are going to start smoking. And honestly, in every addiction, it's your choice whether you're going to continue. But these people typically after 6 months have got a handle on all of the habits and stuff that they had before and are really greatly successful, and they maintain that. We don't follow up after more than a year typically.
Shouldn't it be married with some other personal support for the individual for alcohol and drug addiction?
Absolutely. I would love to see people be in community support groups, even in rehab facilities and any of those types of things, because the best way to get the best outcome is to have as much support as possible. We do offer follow-up support, which will help you to get through those moments, and just by reaching out to us rather than reaching for the drug or the alcohol, you've already started changing your patterns. So that's a great start, but we recommend not only having us, but having somebody else additional there with you as well.
And I would think that motivation is pretty important and commitment.
It definitely is in any addiction. With the treatment, it feels like we take this much motivation and turn it into this much motivation. So it really boosts your ability, it boosts the way you feel, it boosts the motivation level, it creates a basic, what's the word I'm looking for? It creates the outcome that you would like to feel inside, which allows you to act the way you want on the outside.